Hello, and welcome to this Diversity webinar on the SARS coronavirus 2 and the associated disease COVID-19. I am Peter Teska, Diversity's Global Infection Prevention Application Expert. Today, I and several others from Diversity will be presenting this webinar to help share information about the current outbreak. Over the next 30 minutes, we will discuss the current status of the outbreak as of the date of the recording, how the outbreak is believed to have started, our current understanding of how the virus can be transmitted to other people, and best practices to reduce the risk of infection in the general public. We will also present some sector-specific information that applies to food service operations, on-premise laundering, public facilities, and processing plants. The outbreak first started in late November, early December 2019 in Wuhan, China, where a cluster of 40-plus people who had all been to a local seafood market all developed pneumonia. The doctors treating these patients noted this unusual cluster and started raising awareness about a potential outbreak. Testing of the patients could not initially identify a known pathogen as the source of the cluster, so samples had to be sent to other labs for more extensive testing to identify the pathogen or microorganism causing the disease. Since then, a novel or new coronavirus has been identified as the source of the outbreak. This novel virus, the SARS coronavirus 2, is about 80% similar to the SARS coronavirus that caused the global outbreak in 2002-2003. Because the virus is new, many of the associated risks are not fully understood, but knowing that the pathogen is a coronavirus does tell us much about it. As of the date of this recording, more than 75,000 people have been infected globally, with about 2,000 people having died. 98% of the cases have occurred in China, but 25 countries have had cases of infected people coming back to their home country. More than 11 million people live in Wuhan, China, and many shop in the open-air markets in the city. The seafood market where this outbreak is believed to have started sells seafood, but also chickens, bats, civet cats, marmots, snakes, and other wild game animals. It is believed that the virus was initially zoonotic. This means the animal-to-human transmission caused the initial outbreak by spreading the virus from some group of animals to a group of people. It is not known for certain which animals are the cause of the outbreak, but coronaviruses are very common in bats, and horseshoe bats were being sold in the market. Bats can commonly spread viruses to other animals, and these infected animals are not likely to show symptoms of being infected. So it's quite possible people were handling the animals without knowing that they contained the SARS coronavirus 2. Contact with the animal and its secretions or bodily fluids could pass the virus to people. While not initially detected, person-to-person transmission has since been proven and is responsible for most of the cases after the initial transmission event. Coronaviruses are a broad family of viruses named after the crown-like spikes on their surface. These viruses can be found in people and in animals. While coronaviruses typically cause mild to moderate upper respiratory tract disease in humans, they can also cause more severe infections, including certain pneumonias. The mild illnesses caused by coronavirus include the common cold and influenza-like illness. Often when people are sick with what looks like influenza, they actually are infected with a coronavirus. Severe illness caused by coronaviruses includes severe acute respiratory syndrome, or SARS, and Middle East respiratory syndrome, or MERS, and then certain pneumonias. There are some coronaviruses that can be transmitted from animals to people. Both in the case of SARS and MERS, initially the outbreaks were believed to be zoonotic, so the animals passed the virus to people, and then there was some level of person-to-person transmission afterwards, spreading the infection. This virus, the coronavirus involved in this outbreak, was initially identified as 2019 novel coronavirus because it was new, but it has since been found to be very genetically similar to the SARS coronavirus, and that's why it's called SARS coronavirus 2. The disease caused by SARS coronavirus 2 is called COVID-19, and you may see both names in the media. For coronaviruses, once a person is infected, the incubation period is from 2 to 11 days, meaning the period from when they acquire the virus until they present symptoms or when symptoms are visible, suggesting people exposed to the virus will rapidly present symptoms of infection after exposure, but it may take up to 2 weeks to show symptoms, and in some cases even longer. There is even some limited evidence to suggest that the virus can be passed to people without them becoming symptomatic or with only mild symptoms, and I'll talk more about this later. The symptoms likely to present early in the illness are often seen in patients with commonly occurring diseases such as colds and influenza-like illness. High fever, cough, and breathing difficulties are likely to be in the initial symptoms when a person is infected with SARS coronavirus 2. But diagnosis and treatment of COVID-19 should only be performed by a trained physician who can rule out other potential diseases and who can arrange for the testing to confirm the diagnosis. Of those infected, many or even most of those have had mild symptoms, which may resemble the influenza-like illness very common for this time of year in the Northern Hemisphere. But somewhere between 10 and 20% of those infected have developed a more severe form of the disease, including pneumonia, which often requires hospitalization, and about 2.5% of those who have contracted the disease have died. SARS-CoV-2, or SARS coronavirus 2, was likely transmitted from bats to animals to people to start the outbreak. The mechanism of transmission from animals to people appears to be somewhat inefficient, or it's likely that more people would have been infected in the initial outbreak. Rather than having 40 or so people with pneumonia, there could have been hundreds, if not thousands, because tens of thousands of people visit this open-air market in Wuhan each day. Those people initially infected likely had some direct contact with the infected animals and/or their bodily secretions, or may have consumed undercooked meat containing the virus. This ultimately then results in their acquiring the virus and becoming sick. People infected with the virus may cough or sneeze contaminated bioaerosols, which means small droplets of liquid, into the air that may travel up to 2 meters, or roughly 6 feet. Inhalation or swallowing of these bioaerosol droplets likely cause person-to-person transmission. But this is not the only way the virus can be transmitted. If these contaminated bioaerosol droplets settle onto people or their clothing, the person can touch the droplets on their clothing or on their skin, and then touch their eyes, mouth, or nose, resulting in infection. If these contaminated bioaerosol droplets settle onto surfaces, people may touch the surfaces and then contaminate their hands, and then touch their eyes, mouth, or nose, resulting in infection. So it's important to know how long the virus can live on environmental surfaces. Coronaviruses studied in the literature can survive from a few hours to a few days. A recent literature review by Comp suggested that up to 9 days is the survival time for some coronaviruses. So it's possible that a virus could be transmitted to a surface from a cough or a sneeze, and then more than a week later, the virus may still be viable and may result in an infection if someone comes in contact with it. After the outbreak started, the market where this initial outbreak occurred was closed by the China government, and they sent in teams to do sampling of surfaces to see whether or not they could detect the virus on the surfaces. And a number of samples in the wild game area came back positive for the genetic material from the SARS coronavirus 2. So it's highly likely that the outbreak did in fact occur in this area from animals being transmitted to people. When person-to-person transmission occurs, it's most likely where there's close personal contact with a person that is visibly sick. Casual contact in the public is not likely to result in transmission unless this casual contact also involves contact with contaminated blood or body fluid, such as from coughing or sneezing. Typically, asymptomatic people, those that are without symptoms, are at low risk of spreading the virus to others. So a person early on in the disease state is likely not as much of a risk as they are when they present symptoms. As with SARS and MERS, those viruses are spread by droplets, and in droplet transmission, these infected droplets are discharged from the infected person, such as by coughing and sneezing, and travel up to 2 meters before rapidly settling on surfaces. The droplets are not, however, carried on air currents over a larger area, such as might be the case for measles. So this minimizes the risk of ongoing transmission in that the droplets are not airborne for a long period of time. When the method of transmission for a pathogen is not well understood, the World Health Organization and the CDC recommend additional caution, especially for healthcare workers when in close contact with or when treating symptomatic patients. Next, I want to talk about a study that appeared in the New England Journal of Medicine in late January. A report from several German doctors claimed that asymptomatic transmission was possible meaning that a person could not have symptoms but be carrying the virus and could pass it to other people. This caused a lot of consternation in medical circles, as it suggested that the number of people that are being exposed to the virus could be much higher than was previously thought. However, the doctors in this report did not interview the person that was sick. In this case, a woman from China traveled to Germany for a business meeting, met for some period of hours with several people from Germany, and after she returned home, they became sick. When those people were interviewed by the doctors in Germany, they didn't recall the person who was the carrier of the virus showing overt symptoms. But follow-up to this, where other doctors contacted the woman that was initially sick, she indicated that she did have some low level of symptoms and was taking medicines to reduce the intensity of symptoms. This would make the symptoms less visible to others, and it calls out how important it is to understand whether a person is symptomatic or whether or not they simply don't have visible symptoms because they're taking medicine to reduce the intensity of the symptoms. As a general rule, anyone with a fever should, and this is a fever over 38 degrees Celsius or 101 Fahrenheit, should not be engaging in their normal activities until at least 24 hours after the fever subsides. Taking medicines to reduce the fever doesn't mean that the person doesn't have the fever. A person should be without fever and after having taken fever-reducing medicine for at least 24 hours before returning normal activities to reduce the risk of them transmitting an infection to other people. Let's move now to what are the best practices to address this risk of infection. First and foremost, to get your information, monitor official channels for health information, such as the World Health Organization, the CDC, and other government websites. Social media such as Twitter and Facebook should be read with extreme caution, as often the sources of information are not validated, nor do they represent opinions of experts in the field. Second, observe good infection prevention practices. Whether or not an outbreak is occurring, infection prevention practices are common sense hygiene that people should follow. So this includes performing hand hygiene regularly, cleaning and disinfection of surfaces, respiratory hygiene, such as sneezing into your elbow rather than into your hands, using disposable tissues and performing hand hygiene after throwing away a tissue, using personal protective equipment where appropriate, and social distancing, which means staying 1 to 2 meters away from people, especially when they appear to be showing symptoms of sickness. The wearing of surgical masks in public by the general public is controversial, as it only minimally reduces the infection risk for healthy people, and it can cause the risk of depleting critical supplies needed by healthcare staff. So if you're a normally healthy person and you're traveling out in the public, wearing a surgical mask can help reduce the risk of you inhaling or swallowing bioaerosol droplets contaminated with the virus. However, if those same droplets get onto your clothing and on your hands and on your face, when you take the mask off, you may still contaminate yourself and infect yourself by moving the contaminated droplets from your clothing or your skin inside your body through your mouth, nose, or eyes. So this idea of wearing the masks in public isn't something that is generally recommended, and as a result, it is something to be done only cautiously in areas where there's high risk or when the government specifically changes a recommendation to include this as a recommendation. People who are sick with symptoms of COVID-19 or other influenza-like illness are people who should wear masks when in public. And in general, we don't advise these people to be out in public, but sometimes when traveling to receive medical treatment, it's necessary to travel in public. And there, they should wear masks to help reduce the risk that they're going to disseminate the virus into the environment, which could cause infection for others. If you're in China, avoid areas where the outbreak occurred until notified that it is safe to re-enter. A number of countries are advising their citizens not to travel to China until further notice, so know your country's China travel policy. In China, it's advised to also minimize direct contact and or prolonged contact with animals or the uncooked meat, which may carry the virus. In China, it's common to eat wild game animals, and this is likely a big factor in how the virus spread. So eating animals that come from approved sources where there's a certain level of hygiene being enforced is helpful in preventing this sort of infection in the future. The Chinese government recently implemented rules to restrict the sale of wild game animals, which may help prevent future outbreaks of this type. As a general rule, if you're traveling to China and you develop symptoms of fever, cough, and/or trouble breathing, especially within the first 2 weeks of travel, you should contact your healthcare provider and don a surgical mask on entering a healthcare facility. Make sure your healthcare provider knows of your recent travel to China in advance of your arriving at the facility so that they can appropriately triage and assess you before bringing you into the facility where you might be exposing other people to the virus. For workers that commonly handle animals, the risk of zoonotic transmission, meaning transmission of viruses and other infectious organisms from the animals to people, is an ongoing risk. Some standard recommendations to help reduce this risk include workers should use protective clothing such as gloves and masks when handling the feed, water, feces of the animals or within close contact of the animals. Workers should change their clothing after contact with animals and at least every day. Workers should perform hand hygiene throughout the day, especially when entering and leaving animal housing areas, and hand hygiene should also be performed after sneezing or coughing as with anyone else. Workers should avoid touching their face, mouth, and eyes, especially when around animals, and standard cleaning and disinfection practices are very effective in helping to reduce the spread of coronaviruses, including the SARS coronavirus 2. For the general public, the single best way to prevent many infectious diseases, including COVID-19, is through frequent hand hygiene. Hand hygiene helps reduce the number of organisms on your hand, and as a result, reduces the risk of you transmitting organisms that you come in contact with into your body. Hand washing should be performed whenever hands are visibly soiled. If hand washing is not available or if hands are not visibly soiled, the use of alcohol hand rubs is generally an acceptable alternative. The alcohol hand rub should have 60 to 70% alcohol to be effective against viruses such as the SARS coronavirus 2. If you're out in public, avoid or minimize contact with sick people, especially those with influenza-like symptoms. People who are already sick with symptoms should stay home for at least 24 hours after their fever subsides, or wear a mask if they need to travel in public, such as to receive medical care. Cleaning and disinfection of environmental surfaces in public buildings can help reduce the risk of transmission of SARS coronavirus 2 and other pathogens that can cause disease. In a recent article by Kampf, he reviewed evidence of what disinfectants would kill the coronaviruses, and he cited studies that showed that 1,000 parts per million of chlorine, or 0.5% hydrogen peroxide, has been shown in studies to kill the coronavirus with a contact time of 5 minutes. In general, healthcare-grade disinfectants will be efficacious against this coronavirus, but consult your local Department of Health or your disinfectant manufacturer's recommendations for a list of disinfectants effective against the SARS coronavirus 2. For healthcare staff who are generally well prepared to deal with this sort of infection, the health authorities, the World Health Organization, and the CDC recommend observing standard contact and droplet precautions. For healthcare staff, this means, among other things, the use of proper personal protective equipment, gloves, gowns, eye protection, and masks, and where aerosol-generating procedures are being done, N95 respirators or whatever the equivalent is for your country. Frequent cleaning and disinfection of environmental surfaces and patient care equipment should be performed, and frequent hand hygiene using the World Health Organization's My 5 Moments of Hand Hygiene model should also be followed strictly. People who are infected with COVID-19 may seek treatment through a hospital's emergency room. Staff should be prepared to identify and isolate these people so that you minimize the risk of transferring the virus to other people seeking care. Fabrics that may be soiled from contact with an infected person, such as in an initial assessment or treatment room or in a patient room, should be handled with minimal agitation and laundered using standard laundering practices, which we discussed later in the presentation. And lastly, healthcare workers as well should follow good respiratory hygiene practices, including sneezing into their elbow rather than their hand, the use of disposable facial tissues, and performing hand hygiene after sneezing and coughing, especially if the hands are contaminated. For public facilities, outbreaks should not generally need to change ongoing infection prevention practices for staff. If a facility is following best practices, an outbreak doesn't generally change what's done, it just changes the frequency with which it's done. So facilities that are not making hand hygiene accessible to their guests and visitors and aren't prepared to do frequent surface disinfection may need to implement these practices. Providing staff and visitors increased access to hand hygiene, disinfectant wipes, and facial tissues can help reduce the risk of infection and demonstrate a visible commitment to public safety, which is an important part for many people in choosing which providers of services they seek. Transportation vehicles such as trains, airplanes, and subways are higher risk because people are in close contact for a prolonged period of time. So consider infection prevention practices that might be needed to help minimize risk during transportation. And lastly, we've received questions about whether or not packages coming from China should be considered risky or not. And the general guidance is that a package traveling from China is low risk because the virus is unlikely to survive this shipment. And lastly, for my part, I'm going to show a slide here of a range of the materials that Diversey produces for its customers. Most of these are available on the website at the address listed above. That's my part of the presentation, and I'm going to now pass this to the next presenter.
Greetings, everyone. My name is Dr. David Buckley, and I'm one of Diversey's food safety experts here to discuss best practices for control of the novel coronavirus in food settings. Food producers and providers, whether it's a restaurant, grocery store, or manufacturer, are very good at controlling for traditional foodborne pathogens like noroviruses and salmonella. We can apply some of these techniques we already use while reminding ourselves of basic infection prevention methods, many of which are the same methods we use to control the spread of the influenza virus that causes the flu. As always, infected food handlers pose a unique risk because they're not only working in a customer-facing environment, they're also handling the food being served. We're still seeking to fully understand the transmission route of this virus, but it's likely transferred from person to person. So, as you already do, monitor your staff for their health and well-being. It's also important for individuals to take responsibility and inform their supervisors if they are experiencing symptoms or if they have a family member who is suffering from COVID-19. And also, keeping with the topic of personal responsibility, it's good to practice proper respiratory etiquette, which is covering your mouth and nose with a tissue when coughing and sneezing. This mitigates the risk of contaminating your hands and spreading the virus to environmental surfaces. And please remember to throw away the tissue. You don't want someone else picking this up because they could then transfer the virus to themselves. And that's also kind of gross, picking up someone else's tissues. Contaminated hands are also a respiratory virus's best friend. They help facilitate the transfer of the virus to other people and environmental surfaces that are capable of harboring the virus. Another method to mitigate the risk and infection is the tried and true method of hand washing. So please continue to wash your hands after these events occur, such as sneezing, touching your nose or face before eating, and after using the toilet. Remember to lather and scrub your hands for at least 20 seconds before rinsing and drying. Hand sanitizers are not a substitute for hand washing and should only be used in the event no hand washing stations are available. And also remember to check the bottle to see if the alcohol content is greater than 60%. Let's jump to the next slide. And so discussing some of the infection prevention methods we use to mitigate person-to-person transmission, we're going to talk about how to control the virus in the environment. Environmental transmission via contaminated surfaces is a key to controlling the spread of respiratory viruses. Regular cleaning is extremely important, including disinfecting of high-touch surfaces like cash registers and shopping carts. Fortunately, the virus has a lipid-based envelope, which makes it more susceptible to a variety of disinfectant chemistries, unlike non-envelope viruses that you may be more familiar with, like norovirus and hepatitis A virus, which are more difficult to kill. Check with your account manager to see if the wipes you're using are effective against the virus. In food settings, we have to take care because we're working with food contact surfaces. The U.S. Food and Drug Administration has not issued a warning that current cleaning and sanitizing practices used for food contact surfaces are not adequate. So please continue to use guidelines laid out by your local regulators for cleaning and sanitizing food contact surfaces. And remember, if you do decide to use a disinfectant on a food contact surfaces, they must be rinsed after disinfection and ran through the sanitizing process with a food contact sanitizer. This is true for the United States and might be different in other countries, so please, again, go back and check with your local regulators. And, when it comes to warewashing, a lot of questions come up about this, but I think the same guidance should be issued for ware washing. Continue to monitor sanitizing levels, final rinse temperatures, and contact times. The controls here are really critical for the adequate inactivation of these troublesome microorganisms, including this virus. And as for food itself, continue to comply with traditional food safety practices such as time and temperature for cooking, correct food holding requirements, and also special care when handling ready-to-eat foods. If you do have any further questions, feel free to reach out. I'm more than happy to discuss some of the more detailed intricacies of preventing this virus in food settings. With that, I'd like to thank you and have a great day.
Hello, my name is Sylvia van den Heuvel. I'm 28 years with the company. I'm a global application expert for fabric care and part of the Center of Excellence. Within the next 2 slides, I will give you some recommendation for laundry in case of an outbreak situation and also some guidelines on how to handle in a normal, non-outbreak situation. On this slide, you can see the guidelines for the laundry in a case of an outbreak. For handling and sorting of linen, we recommend to follow the CDC guidelines. For the laundry process itself, the preferred option is to apply thermal disinfection, which is in line with your local regulations, and that can differ country by country. But the safest recommendations are listed here below. So we have process 1, which is based on 85 degrees for 15 minutes, process 2, 90 degrees for 10 minutes, and we have process 3, which is based on the World Health recommendations, which is 70 degrees for 25 minutes. We have also developed wash programs for classifications which need special care or treatment. These dedicated programs are in line with the recommendations which are needed in case of an outbreak. You can also use a chemothermal wash process that follows the CDC guidelines, or use a chemothermal process with a locally authorized disinfectant, applied according to the recommended wash process. When there is no outbreak, the normal good laundry practices needs to be followed. The do's and don'ts are mentioned here on the slide per laundry process. Also, the quality and safety guidelines are listed.
Hi, my name is Jan-Willem Tinge and I'm the Global Marketing Vice President for Facilities Infection Prevention, Personal Care and Commercial Excellence, and I've been with Diversey for 17 years. Our Safe Building program is designed to keep your people healthy. Now, your staff and clients may be confronted with the coronavirus, and there's a need to ensure a working environment which is safe. Now, cleaning and sanitation are essential building blocks to infection prevention and outbreak control. So in all areas that you clean and sanitize, please pay close attention to the standard operating procedures using recommended products only. You need to pay specific attention to hand hygiene and frequently touched hard surfaces to avoid any cross-contamination. Now, cleaning and sanitation will reduce the risk of an outbreak. So clean all areas frequently according to the standard operating procedures. Make sure you maintain excellent hand hygiene. Use a disinfectant for targeted disinfection of frequently touched surfaces, and deal with blood or other bodily fluid spillages immediately. Certain high-risk areas need to be cleaned on a regular basis to create protection against pathogen spreads. These areas include high-traffic areas where bodily spills are frequent or where there is a general low level of hygiene. Now, key touch points in a building that need specific attention towards cleaning and sanitation are anything in relation to washrooms, door handles, switches, dispensers, bathroom handles, toilet flushes, shower control taps, toilet seats and splash walls. In the office, think about telephones, specific desks, switches, door handles. By making sure we address these properly, you will reduce the risk of an outbreak. There's 3 essential areas to focus on during an outbreak to keep your building safe. Number 1, apply correct hand hygiene methods. For hand washing, wash your hands effectively. Wet them, apply soap, lather it fully and rub your hands together for at least 20 seconds. Then rinse all the soap off and dry them fully with a paper towel. To make sure you have washed every part of your hands, we recommend you follow the illustration described below. Now for hand rubbing, sanitize your hands. Apply 3 ml of approved hand rub and rub them for 30 seconds. Now do not rinse or dry your hands afterwards. The hand rub will evaporate. Also ensure the availability of stock supplies and keep dispensers full, clean and in working condition. The second point, cleaning and disinfection of hard surfaces during the outbreak. Now please follow all standard procedures towards cleaning. Use approved products with the correct dosing for disinfection of hard surfaces. Start with pre-soaking a disposable cloth with cleaner or disinfectant and remove all gross soil if necessary. Then place it in a plastic bag for disposal. Secondly, clean surfaces with a disposable cloth pre-soaked with a cleaner or disinfectant, and then dispose of this in a plastic bag. Next to that, spray the disinfectant liberally onto the surface, spread with a disposable cloth, making the entire surface wet with the cleaner or disinfectant, and dispose of the cloth into a plastic bag. Allow the disinfectant to act for the necessary surface contact time. Rinse if required. All soiled materials and protective clothing must be deposited into a yellow clinical waste bag and disposed as contaminated material. Afterwards, wash your hands thoroughly for at least 20 seconds using hand soap. Please follow the relevant mini guides for the recommended product in your country for use on the surfaces. And thirdly, clean up blood and other body spillages. Please use standard operating procedures, and if absent, use the general advice instead. When exposed to blood or other bodily fluids, please use below general guidelines. Assess the size of the spill and determine whether to treat it as a large spill or a small spill. Perform hand hygiene and put on appropriate personal protective equipment to prevent bloodborne pathogen exposure during decontamination, including disposable latex, vinyl or nitrile gloves, fluid-resistant gowns with sleeves, face masks and eye-covering goggles or face shield. Note that for certain disinfectants, or if there is a risk of splashing during the cleanup, additional PPE may be required. Refer to the safety data sheet for the disinfectant for additional information. After that, perform one of the following procedures for small spill or large spill surface decontamination. Afterwards, remove your PPE, dispose of the PPE appropriately, and perform hand hygiene. Thank you.
Reducing the risk to your employees, contractors and visitors is critical to maintaining production during any outbreak, and with specific reference to the food and beverage processing industry, there are a few critical elements that are worth to consider. The first one is hand hygiene. Comprehensive hand hygiene procedures should already be in place within your facility. It is key to ensure that procedures are followed and to reiterate training whenever this is required. Make sure that hand rub, depending on the region known as hand sanitizer or hand disinfectant, is available in key contact areas and not just entry and exit of the production environment. For production areas, continue to follow your current GMPs as well as the cleaning and disinfection procedures. Make sure to use an approved disinfectant for targeted disinfection of food contact surfaces as per your standard operating procedures. Pay additional attention to open plan cleaning and ensure that the current chemical and process is being followed in accordance with your existing procedures. Also in this case, reiterate operators training whenever this is required. On non-production areas, high traffic areas should be cleaned and disinfected on a regular basis. For example, changing rooms, toilets, and food preparation areas. Ensure that hand hygiene is performed regularly and hand rub is available. For preventing the spread of infection, employees who are unwell should stay at home to avoid person-to-person transfers. Employees should promptly notify their supervisor if they have a family member at home that has coronavirus infection. And make sure that hand rub is available in all labor-intensive areas.